What do you say we bring him in? Dr. Joe Congini with us. Joe, what do you got for us today?
Hey, Ray. How you doing today?
I'm doing great, my friend.
Good. A lot of people are talking around in the sports medicine world about this time of year, wrist fracture. Can people play with a wrist fracture? There happens to be a professional quarterback over in Pittsburgh, and there's a lot of issue about what's going on with that. And there's a lot of intrigue with issues like that. So I just wanted to talk about that wrist fracture. Particularly, does it matter if it's in the non-dominant, non-throwing hand and things like that? I'm here to tell you that there's many similar sports medicine teams, local sports medicine people like us at Children's, who have faced this question this year and face it a lot during the course of the year. So it happens to be that Aaron Rodgers may be in the spotlight, but this is a pretty common problem. They're calling it a hairline fracture. We're not here to diagnose or treat Aaron Rodgers or anything. We don't know all the details. I have looked at about 15 articles on this with him to see, but nobody's really saying for sure what bone it is that's fractured. But we'll just talk about kind of how we approach these wrist injuries and wrist fractures in high school kids, college kids, professionals playing for lots of money, and even weekend warriors. So there's really four questions we need to answer, Ray. Number one, which bone is it? Of course we need to know that. The most commonly fractured bone in the body, the radius, along with the clavicle, the two are pretty close. The radius is the long bone that goes from your elbow to your wrist. And we get fractures when we fall on an outstretched hand in sports, and small fractures at the end of that radius bone. And a lot in the literature, people are saying that they think his is a radius fracture, non-displaced, hairline fracture. There are 8 smaller bones further up in the wrist that are called carpal bones. You and I have talked about those before in several of our baseball players and other things. But this injury is not just a football thing. In fact, in my career, I'll bet you, Ray, I've seen it more in basketball players coming down with a rebound, landing on an outstretched hand. So it's a common injury. You need to know what bone it is and the details, and that's why they did the initial X-ray on the first day, repeated X-rays and imaging tests, and get a better idea. Know what bone it is and the details of the fracture. Number 2, what's the risk of further injury? And obviously that's variable depending. Am I dealing with a young high school kid, a young phenom kid, a college professional kid, a weekend warrior? What risk do they have? What chance of healing it on their own? In this case, everybody's talking that this one probably is not going to need surgery, so it will heal on its own as long as it's not re-injured. Is it career-threatening? No, it's not, but you certainly don't want to go on to surgery if we don't have to. So a lot of things to look at about risk of further injury. Number 3, Ray, is this person going to need to handle the ball or use that wrist a lot in sports? So what do you think with a quarterback? Do they, on about every single play, need to be gripping the ball, holding on to the ball? And the 2 things for ball handling is the grip going to be okay? Can the athlete grip the ball? And is there a lot of pain when they're trying to play? And so that affects performance in some situations, and the chance of re-injury is ball handling issues. Number 4, is there a brace, a playable cast, a splint? Many times people experiment with different types of splints and playable casts, and I'm sure there's some experimentation going on about what feels good, what's increasing the grip, what's decreasing the pain. But in some situations, it can be the opposite. It can make it worse. So there's a lot of question mark. In football, luckily, you have a few days to try out a few things before you actually have to play in a game. Basketball, sometimes they're playing the next day. But this can affect performance and risk of injury as well. So those 4 questions have to be answered. Many local sports medicine people have faced this issue, and it might not quite be in the spotlight of a professional player. But one other point, I've been so blessed in my career, my entire career. We have in our region such great hand specialists and hand surgeons. They help us make these decisions. They operate on these if there is a problem. They have great training, and they're of the highest quality in Akron and at Children's. So there are great people in town that are hand specialists, and they are playing a big role right now in determining that at the professional level, just like they would in the high school level. So those are the 4 questions that people need to answer. I wanted to kind of go behind the curtain and just tell you how we make these decisions. And I also wanted to bring up one other point, Ray, is my thoughts and prayers with Bernie Kosar. He's the ambassador of Cleveland sports. Thank you to that family that donated that liver. It appears to be a good match so far. He's already texting out points this morning, but he's somebody that we're hoping for a speedy recovery. He's been so helpful to so many in our region. So thoughts and prayers with Bernie Kosar. I did want to cover those 4 things as to how we make decisions on return to play with hairline fractures of the wrist today also, Ray.
Yeah, and I guess what you're saying with these hairline fractures is the fracture is the fracture. And, of course, the ultimate question is, and you've heard this going for so many years, is there a risk of further damage playing with a hairline fracture?
Sure there is. And it might even be, I talked with one of my hand surgeon friends, it might even be higher in somebody who's 41 than somebody who's 14 or 15. They may be healing a little bit quicker in our younger population. But, yes, there's some risk. But, again, it's not an overwhelming risk. At the stage of career and the height of what they're playing for and everything else, as they look at a lot of things, they'll make those decisions. You know how we are here. We don't look in because we don't know all the details, but there definitely is some risk, right? Falling on it, throwing with it, getting every single snap. That would be some risk. So they're facing all that. In the next 3 days, they'll answer these 4 questions I talked about and decide whether it's worth that risk for him to play.
Yeah, well, certainly I was reading some stuff that's his favorite place to play. He's put up some big numbers. Speaking of Aaron Rodgers, they said that'll really take a big broken hand to keep him out of the lineup on Sunday.
His record is pretty good in Chicago, isn't it, Ray?
It is, my friend. Well, listen, I know you're going to be going up Route 8, I imagine, Friday night, right? Walsh and Hoban. I talked to the 2 coaches, and everybody pretty excited to head up to Bedford on Friday night. I imagine you're going to try to circle that.
Yep. Everybody's going to be dialed in for that one. Really, really good game. Both teams have really matured to a certain point. This is exactly what you look and hope for in a playoff. I hope everybody plays at their best and highest level, because if they do, this is going to be one heck of a great football game Friday night.
Yeah, I agree, my friend. I agree. Well, Joe, as always, my friend, thanks for taking the time to join us here on the show. Much appreciated.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. As I mentioned, part of this show for 30 years, a great sports medicine insight. He's a fan, and, of course, all of us, and we've said this on the show, prayers and thoughts continuing to go out to one Bernie Kosar as he recovers. And Joe said it best there, that family with the liver donation, and it looks like it is a good match.